Miscarriage. This is the spontaneous loss of pregnancy before the 20th week gestation, and this can be both physically and emotionally painful. It is very common. In fact, some studies show that over 30% of pregnancies end in a miscarriage, but women who miscarry still go on to have full-term and healthy baby. Now in today's video, we're going to be talking about miscarriage, the causes of miscarriage, the symptoms, when to try again for another baby after a miscarriage, what to do next after a miscarriage. So hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. If you're interested in this topic, keep watching. Although miscarriage can be both physically and emotionally painful, but one good thing about miscarriage is that the woman knows that she can actually get pregnant. It means her tubes are open, everything is fine, and she can get pregnant. And I know you'll be wondering, if everything is okay, then why did she miscarry? Well, the important thing is that she knows that she can get pregnant. She did it before and she can do it again. So what are the causes of miscarriage? There are several reasons why a miscarriage can occur, ranging from chronic conditions. We have diabetes, hypertension, then infections can be a cause too. Then we have abnormal chromosomes, weak cervix, some medications can cause miscarriage, and alcohol abuse. That is why I won't personally advise any woman who is trying to conceive to be consuming alcohol, especially frequently, because you might not know when you end up getting pregnant, and by the time you get pregnant you have a lot of alcohol in your system. You might even still be taking alcohol. Too much of alcohol can lead to miscarriage as well. The next cause is smoking, food poisoning, lifestyle, maternal age, that is advanced maternal age, overweight, use of substance like cocaine, immunological disorders, environmental hazards, thyroid disease, and previous miscarriages. That is why when you have a miscarriage, it is always good, it is important for you to find out the reason for this miscarriage so that you can treat it and prevent another occurrence when you get pregnant again. So what are the symptoms when you eventually have this miscarriage? The most obvious symptom of miscarriage is vaginal bleeding. You may experience blood, fluid, or tissue coming out from the vagina during the early stages of a pregnancy. This can be a sign of a miscarriage. That's why I always tell women, when you're pregnant, you've confirmed that you're pregnant, and you notice bleeding of any type, notice blood coming out from you at any point in time throughout your pregnancy, please go to the hospital and get that checked out. As long as it is not implantation bleeding, go to the hospital and get that checked out. Another symptom is pain in the lower back, the abdomen, or the pelvic area. Then uterine contractions, fatigue, cramps, vaginal discharge, nausea, and vomiting. These are all symptoms of miscarriage, and when you experience any of these signs during your early stage in pregnancy, try to go to the hospital, see your physician, and get that checked out. Now, how can you prevent these miscarriages? First of all, you need to find out the predisposing factors, that is the causes of miscarriage. So find out these causes and prevent them. That way you can prevent miscarriage. Then secondly, you need to do testing. You need to do genetic testing, immune testing, and hormone testing. Do all these tests to be sure everything is okay with the hormones, the gene, the immune system, to be sure everything is okay. Then you can try for a baby. Then check the egg and sperm quality. Poor egg quality or sperm quality can lead to miscarriage. Then try to lower your BMI, that is, try to reduce your weight. It can help prevent miscarriage from happening when you eventually get pregnant. Now let's talk about when to try again after a miscarriage, what to do after a miscarriage. So this is what to do after having a miscarriage. First of all, you need to find out the reason for this miscarriage. Why did you have this miscarriage? What caused this miscarriage? And you need to do that by going to the hospital and getting that checked out. Then was there a complication following the miscarriage? Did you have any complication after the miscarriage? Is there an underlying medical condition causing all these miscarriages or the one miscarriage you had? Is there an underlying medical problem causing it? If there is an underlying medical problem, you can treat the medical condition so that you won't experience another miscarriage. It is very important. Also, there are some tests your doctor will ask you to take, maybe hormonal tests or any other type of test, just to find out the reason for this miscarriage. Also, try to find out if there are retained product of conception. That is, if after the miscarriage you still had some tissue, the fetal tissue still there, this can lead to more bleeding. So you see, when a woman have miscarriage but is still bleeding continuously, they need to go to the hospital to check and be sure that there are no retained products of conception still there causing this bleeding, because that is a major reason why you're still bleeding after a miscarriage. Now, when should you start trying again after a miscarriage? First of all, you need to recover physically and emotionally. Miscarriage can be draining. It can be draining both physically, it can be draining emotionally, it can be draining even mentally, especially for a woman who have been trying to conceive and then she eventually conceives and miscarry the pregnancy. She's going to be dealing with a lot, both mentally, emotionally, and even physically. So you need to first of all recover. Then after recovering, you can start trying again. First of all, you need to follow up your HCG level. HCG, which is the human chorionic gonadotropin, indicates pregnancy. It is a hormone that indicates pregnancy, and this hormone simply stops ovulation, menstruation throughout the pregnancy while maintaining the pregnancy as well. So the HCG level after a miscarriage is supposed to go down. That way there is no trace of HCG in the woman's blood, and ovulation can start again, menstruation can start again, and the woman will be able to get pregnant again. So the HCG level goes back to 0 depending on how long that pregnancy lasted before you miscarried. Like if the pregnancy lasted for a week or 2 weeks, it is going to be faster for the HCG level to go back to 0 than when the miscarriage occurred after like 10 weeks, 15 weeks of the pregnancy. It will take longer time before the HCG level will go back to 0. After you get your period back and start ovulating again, you can start trying for another baby as soon as you want. In fact, studies have shown that women who start trying for another baby as soon as possible after they had a miscarriage are more likely to get pregnant faster than women who wait for months after a miscarriage to start trying for another baby. So my advice is, when you're done healing physically, emotionally, mentally, and you feel you're ready to try again, just start trying again. You don't need to wait for months. So if you've experienced miscarriage before, I'm sending out love and encouragement to you. You did it before, you can still do it again, and this time around is going to stay. So with this, we've come to the end of today's video. Please ignore the sunlight reflection on my face. If you had fun watching, please do well to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section, and I'll be there to respond. If you have any questions, turn on your notification bell, because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next one. Bye.